Great. Welcome, everybody. My name is Jennifer Marr. I am the chairwoman of the Putnam County Business Council. We are a completely volunteer organization, and we are doing our best, coupled with our Economic Development Committee, to bring you all the latest and the greatest in this pandemic to help small businesses be able to figure out what's next and what's coming down the line. I would like to welcome my panelists. We have, of course, I will be introducing Congressman Maloney in just a couple of minutes. We also have Kathleen Abels of the Putnam County Economic Development Corporation. We have Bull Nulk of the Putnam County Industrial Development Agency. And we have Amy Sage, who is a Putnam County legislator. We have Bill Goldman, Putnam County legislator and Economic Development Chairman. Sal Gambino and George Joyner of SCORE, but I think we just have George. Tracy Walsh, Putnam County Tourism, and Faith Ann Butcher of United Way of Putnam and Westchester is here just to give us a little community update later on. So welcome, Congressman Maloney. Thank you so much for being here. And we look forward to hearing whatever updates you can give us. You know what the million-dollar questions are. So thanks for being here.
Well, listen, thank you all. And I wish we could be getting together under better circumstances. Obviously, you all know what's going on out there. Let me give you a quick update on sort of the public health side of this and on the economic side of it, the Washington side of it. I think most of you probably know we have about 250,000 cases now in the state of New York. About 10% of those cases are in Westchester. It goes down from there as you move up the Hudson Valley. We have had close to 1,000 fatalities in the 4 counties that I represent, all are in part. Most of those would be in Westchester County. In Putnam County, we have, I believe as of today, about 599 confirmed COVID cases. The good news, if there is any, is that in Westchester, Orange, Dutchess, and Putnam, the rate of new infections on a daily basis has slowed to 2% or below. That's much better than it was just a couple weeks ago when we were seeing 20% daily increases. So really just doubling the number every couple of days. Now we are clearly plateauing, and because people will be resolving over time, God willing, most will make full recoveries. We can, reliably predict that as long as we keep up the social distancing, we will be moving through the worst part of this right now. In fact, the worst part may be behind us, even though we still have a very high death rate in New York, which is, of course, an indicator that is going to be what they call a lagging indicator. The rate of hospitalizations, the rate of intubations, all of the leading indicators are going down. So that's the good news.
That is good news.
Now, obviously, this has come at a terrible cost to the economy. All of you know that. We passed a big package in Washington, really 3 packages in Washington. The first was focused on 3 things: paid family leave, testing. The first thing that came out of Congress was the need to have more testing and to fund it. That was way back in early March. And the third part of that first package was supplemental nutrition assistance, food stamps for people who are struggling to put food on the table. Second package focused on the research side of the epidemic, $8 billion directed towards speeding towards a vaccine, better research on repurposing existing therapies, the kinds of things that would help us combat the virus itself. Third package was the biggest thing ever passed by the United States Congress. It happened very fast and in an overwhelmingly bipartisan fashion, which are not 2 things you usually hear about Washington these days, that move quickly and in a bipartisan fashion. As the $2.2 trillion package, the heart of that package was really 3 things: the direct cash payments that should be going out to Americans right now. 60 million Americans should have received direct deposit payments of up to about $1,200 an individual, $2,400 a couple, $500 per kid. If you had adjusted income of $150 less as a couple, you were going to receive that full amount. Now, the second big piece was the expanded unemployment insurance benefits covering, the 20 million plus people who have filed for unemployment in just the last month. That's a staggering number. More people have become unemployed in the last month than all the jobs created in the last decade. So it's an unprecedented situation. And there's a massive new program in place to provide more generous, more comprehensive unemployment benefits to folks who find themselves out of work. Third big piece, probably most relevant to all of you, is the Paycheck Protection Program, which is designed to basically lift everybody's payrolls and costs for at least 8 weeks, probably longer. Now, whether we can do that, whether that's feasible, whether this program can be big enough and generous enough to live into the promise of, hey, keep your employees and we'll make you come out whole, is, I think, a really open-ended question, and it's one business leaders are worried about. Some of you have been hearing there were a number of problems with the initial rollout by the Small Business Administration of the program. They really boiled down into a couple of bottlenecks. If you were a direct SBA lender, you were waiting on the guidance from SBA. It took a while to get that out. You would have had hundreds of approved loans at that point, but it would not be out the door. That should be resolving itself because the guidance is out. Those banks should be sending out that money. There's secondary lenders who can't lend directly through the SBA programs, but who can lend through an SBA entity. They had limits on the amount of lending they can do to any single entity. They have a lending limit regulation that was bottlenecking that. That's been addressed. The third big issue is that by the time those first two issues are out, the overall program is oversubscribed, and therefore you get people with these stories of saying they say there's no money left. That's technically true, but we're working on a deal right now in Washington to double the size of the program by another $350 billion. And that should, at least in the short term, address some of that frustration. Some of you may be in that position. I've heard from a bunch of local business folks who say, we don't know anybody who's received these loans or gotten this money. There are some really frustrating data points around the way the SBA has administered it up to now. For example, 44% of the total loan amount has gone to 4% of the applicants. So that just tells you that the overall size of the initial loans were too big and too concentrated. Bloomberg had a story day before yesterday, I believe, pointing out that 73% of eligible payrolls in some states in the Midwest, like Nebraska, have been covered. 73% of eligible payrolls. In New York, that number is 20%. So New York is not doing very now. Our eligible payrolls are going to dwarf those in a state like Nebraska. So the overall size of the problem in New York is much greater. The incidence of the epidemic is obviously higher here. The economic injury has been greater and earlier, started earlier here in New York. So there's a bunch of reasons why New York is going to be worse off and be a harder problem to fix, just because we're such a big economy. We have $1 trillion economy in the state of New York, the size of Russia. So trying to cover all that eligible payroll at the same time as we cover all the newly unemployed people and do direct cash payments is obviously a massive undertaking. I think the design of the program is pretty good. The big questions are, can they implement it in a way that shows up for people that makes sense if they're actually trying to keep their employees on the payroll? And that is being worked out right now. And the second thing is are we going to be able to make it big enough and enough to live into this promise kind of for everybody? And so therefore, if you haven't gotten your money yet, should you be understandably nervous that you're going to get screwed? I don't have good answers for that. I think those are the questions I'd be asking if I was trying to manage a payroll in a 25-person business here in the Hudson Valley, right now. I think that the next tranche of money into the Paycheck Protection Program, which should be agreed on today, should cover a lot of those folks we've been hearing from. I'm hoping that will address a lot of the needs of the people who I represent in the short term. A couple other quick points. There's a big issue that's holding up the deal in Washington right now around aid to state and local governments. For reasons I don't fully understand, this is a big partisan issue. Democrats want to do it, Republicans don't. That is more like a dynamic we saw around helping the state after Superstorm Sandy, or the Zadroga funding for 9/11 responders. It became divided along partisan lines. That's a problem because New York is going to have a massive budget deficit at a lot of levels, the state, the county level, at the city level. And so getting help from Washington on that is going to be the difference between avoiding big layoffs in the state or having big cuts to programs or not. And so that's a real issue for us, much more so than some of the other states that might be holding it up. So I don't know whether you'll see that resolved today. I think that will get kicked down the road, if I had to guess, to get a deal on the Paycheck Protection Program and get that done, because people need that right away, together with funding for hospitals, which is important, and some smaller items. Last point I make, I guess, would be about our local agriculture businesses on the east side of the river. It's maybe less of an issue than for the folks that represent Orange County, where agriculture is a huge part of the Orange County economy. Our farmers are doing okay under the program the way it's been designed. Dairy producers and others who've been under a lot of pressure, especially crop producers, should do okay. It is the big guys who I think are going to really scream. It's not going to cover their situation. There are some major problems in agriculture right now that center around the food processing plants and some of those issues you've been seeing about on TV. Those will be less relevant to us locally, except when we go to the grocery store and you have more trouble buying meat or the brand you want. You may see some disruptions like that. But I think in terms of our local economy that's based in agriculture, the program is designed pretty well to address our needs. But there are going to be people who are hurt. I think we have all started down this road together with the expectation that maybe we can act as a community in ways that can avoid the greatest pain. But the fact is that we're all going to come out of this hurt. We have lost neighbors and friends here in Cold Spring. There's heartbreaking stories of local families that have been devastated by losing someone they love. And that's true on the economic side of the crisis as well, too. No matter how well these programs are designed, how generous they are, there are going to be people who get hurt. There's going to be a real reduction of economic activity for a significant period of time. It's unclear how quick and how strongly the economy can come back. Some people will never be the same again. And we're never going to be able to address all those needs. But we are working very hard to shorten the duration of the crisis, to bring the economy back as quickly as possible, to try to protect people as much as we can. But I would love to hear your experience. So let me stop talking, and I'd love to hear about what's going on the front lines from all of you. Thank you very much. And I should just add, the people on the call with me who work for me are happy to work with any one of you to follow up on an individual basis. We're here to help. We're helping hundreds of people now with all kinds of aspects of the crisis. Thanks. Back to you, Jennifer.
Thank you, Congressman Maloney. And I'll tell you, I've worked with you in the past. I don't know if you remember walking around the streets of Mahopac or Mahopac, as I say it, trying to get money for parking, which is actually finally happening. So we're pretty excited about that. So thank you. Your office is always accessible, and they've been great all week long in the last 5 or 6 weeks when I've been sort of driving everybody crazy. Just one, the big thing that's on a lot of people's minds today was seeing how a lot of that money went to national chains. No offense to national chains. That's the big question out there. The money that went to, let's say, Ruth's Chris Steakhouse probably could have saved most of the restaurants, all the restaurants in Putnam County, and a bulk of restaurants in Westchester County. And in a place like Putnam County, where we have very few national chains, so that's not going to do much for our local economy and our employment rate. What do you say to a county like us in that situation?
Well, like you, I'm not even against the people running Ruth's Chris Steakhouse, right? And I know that everybody's hurt. I make a distinction between franchises and big chains that are owned by a central entity, right? So it's one thing if we're supporting local franchise owners who are small business people and our neighbors. It's another if we're supporting, Danny Meyer, who's owned Shake Shack, who gave the money back. Which was some money back. Yeah, well, it's something, I guess. Yeah. But look, and so I think in the first instance, a bunch of us are demanding that there be better guardrails in place to prevent that kind of thing from happening. Now, it could be done at the SBA and agency level, at the administration level. So Congress doesn't need to write all this stuff into law for these guys to administer it, right? But hey, there's probably plenty of blame to go around. These things are done incredibly fast, and there is a competing goal here to get this thing done and out the door so that we're helping people sooner rather than later. So it's a balancing act. I think you can fix a lot of these problems by reducing the size of the initial loans and making sure it's spread more evenly. You've got to get the bottlenecks out of the way with the guidance for the banks, and the banks have to issue the money. I think most of that stuff's been worked through right now. And if we double the size of the program in the next couple of days, which I think you will see, I think you'll see a lot of the folks that we know and care about locally start to get the right answers. Some of the stuff is also, the individual banking relationships. I know people have had very different experiences. I was just talking to a friend who's pretty well off and who's a pretty sophisticated customer, works with Chase Private Bank, and he got nowhere. And he's as well wired as, you would hope to be. And so, I've heard from other people in his position who did just fine, or, so I do think some of this has to do with individual banking institutions, and people may have different experiences. I do think a lot of that will be worked through. I don't think anything justifies doing 44% of the program to 4% of the applicants, or covering 73% of the payrolls in Nebraska and 20% in New York. That just infuriates me, frankly, since we are the center of the storm here. So good news is you got a New Yorker running the small business committee who's focused like a laser beam on writing some of these guardrails into the new package. And if we get rolled on the state and local stuff in this round, as we may, because our friends on the red team are just dead set against it, then one of the things they may give in exchange for that are better protections within the Paycheck Protection Program that would address the thing you're talking about. Okay. So I think we're going to do better, but we also got to just go bigger because we just got a huge need we're trying to fill here.
So you do think we're going to get a second round of funding to the phase 3 portion?
Yeah, well, I mean, I can walk you through that. So you'll hear the terminology around this is getting confusing because you'll hear people talk about the interim package. You'll hear people talk about COVID-4. You'll hear people talk about 3.5. Basically, there were 3 big things we did. I laid them out for you. Yep. First, around testing, paid family leave, and food stamps. The second was around research and testing and a vaccine. The third was the CARES package, the $2 trillion bill. What they're talking about now would be a measure that would double the size of the Paycheck Protection Program, put another $50 billion or so in the direct SBA lending programs and disaster loans, and do some money for hospitals and maybe some smaller things. Kick the can on everything else, get that done so we can get small businesses more help. In the next round, whatever form that takes, you're going to have a conversation around aid to state and local governments. Yep. And you're going to probably have a lot of other needs that are still not being funded, right? Just on the front sort of lines of the epidemic. In addition to that, some of us are pushing very hard for what I consider slightly longer term, but really important stimulus measures like a massive infrastructure package, which we could do in May. We could do a $10 5-year infrastructure bill a month from now, and that would have really beneficial effects on the economy over the next year or two as we put that money to work. So all of these things are going to be an opportunity to get more resources to local folks who need it in one form or the other.
Okay, great. So let me open this up. I don't know, want to start with you, Amy Stage, since I can see you first. Introduce yourself. You're on mute. Hold on, you're muted. There you go. There you go.
Can you hear me now?
Yeah. I can.
Hi, Congressman Maloney. Thank you so much for listening to us today. I am a Putnam County legislator. I have a question from a constituent. Why is the House waiting on such an important matter with real threat to financial health of this county? Why are they waiting to vote on this package when people are hurting today?
We're not waiting to vote. We're trying to include in the package measures that would be enormously helpful for the state of New York. So one of the things that is endlessly frustrating for me is that as it is the national Republican folks who don't want to do state and local aid. They just have an objection to it. They think there be subsidizing bloated state bureaucracy, I guess, trying to be fair. They don't want to do that. So if you're trying to get the Paycheck Protection Program done, you can just do that, and that may be what happens because we just can't wait. But what's going on in the House is the Speaker is trying to combine that with something that is at least as important to the state of New York, which is enormous help to state and local governments so that we can cover some of these expenses. Otherwise, you heard the governor say this morning he's going to have to cut education by 20%, or he's going to have to cut money to other programs by about that amount. And so I think that puts some of us from New York on the horns of a dilemma. But I do think we should probably proceed with the Paycheck Protection Program without any further delay and circle back around on the other things. Now you'll hear Andrew Cuomo and others scream about that, and he'll be right to, and folks at the county level are going to be hurting too. I mean, Marcus Molinaro or Mary Ellen Odell are going to have the same concern. They're going to want to make sure the county government gets it, not the state. And there's a fair conversation there. But in the Democratic proposal, the counties would have got tens of millions of dollars right now. Yeah. So you tell me, right? I mean, if we're laying off a bunch of state and county workers, does that make the problem better or worse? If I'm a week earlier on the Check Protection Program, which is going to keep people employed at restaurants and other businesses, the problem is we need to do both. And but the other side is losing interest in helping states like New York that are on the front lines. I don't know how else to say it. They just don't want to do it.
Can I ask a second half of that question? There's a business here, a certified women minority-owned business here in Putnam County, who did not receive any funding with the first round of the PPP. And they're afraid they're going to be left out in the second round. I think it's important that maybe these businesses are addressed first. I understand we in Putnam County understand a lot of this, the finances from the state of New York are going to be pushed down to the county level. Hopefully we'll address that, but I think the first thing we need to do right now is address these businesses that are failing, that are struggling. This particular business is a construction supply company who's probably lost a lot of their business during the shutdown, and they're afraid they're not going to be able to continue after this. I'm just wondering if there's any funding for the women-owned businesses in this next
Yes, well, the answer is there will be additional protections specifically for that type of business in the package that we are negotiating right now. And it would be my hope that if we delay, if we kick off to another day, the state and local government help, that one of the things my friends on the Republican side of the aisle will give would be more protections into the Paycheck Protection Program around size of the loans, small businesses, family-owned farms, BW businesses, the things you're talking about. And we should write that into the legislation. What you don't want to do is you don't want to create so much bureaucracy that you slow down the program. So that is the balance, but that is precisely what is being demanded on the House side right now. It's not just the overall size of the loans going out, it's who's getting them.
I would just hate to delay help for our constituents because of politics. It's really disheartening. We need everybody to work together, and I appreciate all your help in that.
Amy, amen. But if working together means screw New York, I don't know how you would resolve that. It's easy to say we should all work together. They aren't working with us to help New York. So if they're holding as a hostage the Paycheck Protection Program, that puts us in a position. So I can get it to you a week sooner, but then you're going to have a $10 billion deficit in New York City, let alone the state. So if you're dealing with local layoffs, if you're dealing with cuts to education, if you're dealing with cuts to county aid, if you're dealing with higher Medicaid bills for the counties, that's going to bite us just as sure as anything. So I hear what you're saying, and I am trying to address the need. I know you're, and frankly, I'm agreeing with you. I think we should just get the Paycheck Protection Program done, call it a day, and then just keep fighting about the other thing, which we do have a little more time to fight on, I think. But I'm worried about losing leverage on that.
Yeah.
I hear you.
Thank you. Thank you.
The problem is it compounds. It's, we're all on pause, working from our living rooms. I have court in my living room every day. It's crazy. And, but the problem is for small businesses, when they don't know what kind of relief they're going to get, and they just wake up every day thinking about that, they're not able with everything else that they've had to take on, homeschooling, and I could go on and on. I have to go do family grocery delivery a few times a week and just getting the orders together, and it's what you get it. when they don't know what they're going to be getting, they don't even know how to start planning their businesses for the future. It's very difficult. It's very and every day that goes between being a functional business and not, it gets less and less likely that it's like being on the ventilators. I hate to put that comparison, but the longer it goes on, the less likely that business is going to survive. And there's not a lot of reassurance happening, so anyway, let me open this up. Kathleen, you want to ask your questions, and then Bill Goldman will go to you.
And Jennifer,
Yeah.
I hear that concern, and let me just, because I don't want in the back and forth of this to be unclear. My expectation is that I will be getting a plane or driving myself to Washington on Wednesday to vote for a package that will double the size of the Paycheck Protection Program and put in the bloodstream another $350 to $400 billion to the program you're talking about.
Excellent.
It's not done yet, but I think you'll see that happen in the next 48 hours.
Great. That's good news. And then, okay, we'll leave it there. Kathleen.
Yes, Senator, thank you so much for taking the time to join us today. My question is from a small business owner in the town of Patterson. He wrote in that he sent in his PPP application to his lender on April 8th, and he hasn't heard back yet. Will there be any funding available for him at some point in time? Well,
I mean, that's what I was just trying to say, is that yes, the answer is, I don't know where his application is. My staff is willing to work with anybody individually, by the way, and some of the resource centers that are available locally are good help as well. So please, people on the phone with us from my staff, I'll also give you my office number. It's 845-561-1259, 845-561-1259. You're welcome to call us, and we'll kind of provide concierge service for folks. But that's the money I'm talking about being passed through the Congress in a bipartisan fashion Wednesday.
Great.
That's our current expectation. But it could take a day or two more. Don't hold me to that. The deal hasn't been struck yet.
Right.
But I do think that's going to happen this week, and that should provide resources for those folks who are still waiting. Whether we can do this indefinitely, whether we can cover everybody who's been hurt, I just don't know, and I don't want to give false hopes on that.
But there's some hope right now.
But that will bring to $700 billion the amount of money we've spent just on the Paycheck Protection Program in a few weeks' time.
Do you think that they'll slow it? I mean, I would rather have it slow the rollout a little bit and try to see around the corners that you've already bumped into, to try to make sure some of this funding goes to the actual micro businesses. They're not small businesses. Our counties and most of the counties in your district are micro businesses.
Right. Well, this is where you could help me a lot. I mean, what would be helpful a lot is if we can hear lending institution by lending institution what people's experiences are, because different banks are doing different things.
Yep.
And that is going to be really valuable feedback for us. I mean, it's one thing if you've got a direct Hudson Valley, credit union,
Yep.
which is a direct SBA lender, should be able to be putting money out the door right now. If you're a secondary lender, you've got to get out from under your lending limit regulations. Those are some of the other local banks. I think Rhinebeck Bank is a direct lender.
Mm-hmm.
But if you're dealing with Bank of America, or you're dealing with Wells Fargo, you're dealing with Chase,
Mm-hmm.
You may have a different experience. But let my office work with any of your members or anybody who's having a bad experience.
Yeah.
We want to know what's going on. By the way, the SBA can put out data on this. So if I sound frustrated, it's because it's very hard to know what is happening out there if the SBA doesn't produce data that should be at the congressional district level, the way we do with every other federal program, by the way, to say, here's how many loans have gone out in the New York 18th congressional district. Here's how much they were. Here's the average loan size. Here's what's going on by county. That should all be known so we can know what we're talking about. Some of the numbers I've cited are from private analysts or banks that have done this research and got at it different ways. But we need to know what's going on in the program.
Agreed. All right, Mr. Goldman.
Congressman Bill Goldman, County Legislator in Putnam County. I don't know if you know this answer yet, but the new money that's coming into for the package for small businesses, will the procedure be the same, or the individuals who have already applied, who haven't received the money yet, will they get the money first? Do you have any idea what's going to go on there?
my best understanding, Bill, is that if it depends what your bottleneck is, right? Like I can talk to people and one person will say, well, I've been approved for the loan, they haven't given me the money yet. But if you talk to the bank, they're going to say, it's because we didn't have guidance from SBA. Now that we have the guidance, yeah, we'll put the money out, right? Another will say, well, we've got these 100 loans approved, but now SBA says the program's out of money, so we're holding them up until we find out you guys have passed more money into the program. But so the answer to your question is the rules shouldn't change that in a way that would affect people who were kind of waiting in line, right? They should start getting money because some of the kinks have already been worked out, and now it's just filling back up the reservoir of funds. So I think that's the good news. I do think some of the problems we've seen around the loan sizes and who's getting it more quickly would be the changes some of us would be seeking to make sure more of it's going to small businesses, family firms, the kinds of people who are really, hanging by a thread right now. Those are the only changes I'm supporting that I know about.
Thank you.
Thank you. Bill Noak?
Hi, thank you, Congressman. It's Bill Noak from the Putnam County IDA and also the Business Council. And first question I have is from the director of our Brewster Cultural Arts Coalition. And he's wondering if in all this mix, is there some kind of funding source for the very small nonprofit or arts organizations, many of which really have one or maybe that's it, but volunteers, but they also have rent, utilities, insurance, the other experiences, and no income. So they're looking for some kind of funding for that. You know if that's part of any of these packages?
Well, 501c3s were included in the first program.
Right.
So they should be eligible for a Paycheck Protection Program loan, just like a small business. So I think that's the answer. Whether they've got it or not is some of the issues we've been dealing with everybody else. But my staff is available to work with anybody individually if they're having trouble with that. I know this can be daunting for a small shop.
Right, well, that's probably one of the bigger issues is for the really small organizations, just finding somebody to put in the paperwork. But that we can overcome. And then from my IDA side, looking forward is while we've got this crisis going on and things are starting to turn around, we know that coming out of this, we're going to have a new normal when we get done. Are we looking forward, or is anybody starting to think about what our workforce is going to need to look forward to as we come out of this? And, I know it's early, but it's something that people are going to have to start thinking about because we've got a lot of training to do to bring ourselves into the 21st century.
Well, it's a great question, Bill. I mean, the number one thing we don't have is going to be the rapid results testing, both for the virus and for antibodies, that will allow us to know if a healthcare worker is, going to work, whether they're carrying the virus or not. That would allow us to know whether someone's had the virus or not. The state of New York right now just announced they're doing survey testing for antibodies, which is a great step because what they'll do is they'll go out and they'll test 3,000 people think of it as a poll to sort of find out who has had exposure to coronavirus. And we know that by testing for antibodies. That gives you good data on how many people are walking around out there with immunity. If it's higher than we think, and many of us may have had exposure to coronavirus and never had any symptoms, which we think is very possible, and may explain, the way it has spread so efficiently, even with people who are without symptoms, right? Then we'll have good data on having better immunity out there, and then we can address reopening in a way with some more confidence. So it really all starts with testing. You've got to do more testing more quickly, both for the virus and for the antibodies. And then I think what you'll see, Bill, is I think you'll see us sort of stage back into a functioning economy, right? If you guys go to Home Depot right now in Fishkill, there's going to be 2 people at the doors, entrance and exit, counting. So there's only 70 people who go in. Everybody's going to be wearing a mask. There's going to be social distancing, sanitary wipes. You guys have done this at the supermarket. So I think you'll see more businesses open with those types of procedures. And that way, at least we can get some people off the ground again and have more and more businesses operate the way the essential businesses are operating now. And now, you're not going to be able to make your numbers work in a restaurant if you can only have 25% of the people you used to have. I mean, there are some problems with that still. But from a public health side, it can work, so you don't restart the virus while you're trying to restart the economy. And I think you're going to see you're going to have to see some reimagining there. You're going to have more remote work still going on. You're going to have more allotment for things like paid leave and that sort of thing to help people adjust to this reality. I think many of us are hoping that will be a period of months, not years and years or something. And so, because really what we're trying to do is to get to a vaccine and effective therapies, right? And if we can through testing get everybody back to work in a few months, then we can keep the epidemic under control while we have those therapies and that vaccine, and then we're done. So I do think once we're on the back side of this thing, it's going to feel very differently and better.
Right. Thank you.
So is there any actual timeline on getting more tests? I mean, we've had so few tests in the county here. So when we hear testing, we kind of giggle. So right. What is the reality of that? And the antibody test, I'm not hearing anything great about that. I'm hearing a 50% false positive or false negative rate. And as far as the testing goes, we have gotten little to none. We never got a testing facility here, although I know we fought for it. So
yeah, well, I mean, sort of yes and no. I mean, there's the truth is New York is doing more than any state in the country, and by a long shot. So that's the good news, I guess. The bad news is we have far more cases. In Putnam County, Putnam County has been serviced by the Anthony Wayne Drive-Through Testing Center at the top of Palisades Parkway, right across the river, and at the Dutch in just north of Beacon. So those are pretty good options if you're on either end of Putnam County, but also, there are a number of private groups that have been doing testing. But look, it's been a mess. I think that if there's one great failure of the administration on this, it is that the diagnostic side of this thing has never been properly organized. There should have been a centralized presidential command and control structure here. There should have been use of the Defense Production Act to govern all aspects of the acquisition and production and distribution of the testing materials and of the key machinery for our hospitals. There have been inexcusable delays, and we're still paying the price for that. But you are seeing the private labs, the state labs, states like New York, and counties like the ones I represent really try to step into that void. But to really scale it to the level you want, it's still the only game in town is going to be if you get more going on at the federal level, like any national crisis. So I wish I had a better answer for you, Jenna. What I can tell you is that I believe New York is doing as well as any state in the country right now, but it's still not enough.
Agreed. Thank you. I appreciate that. Who's next? We have Tracy Walsh.
Hi, Congressman. How are you? I actually have two questions, one from a constituent and one of my own coming from the tourism standpoint. I've been very busy on calls and trying to understand I know the 501c3s have been included in this phase, as you said, to bill, but the 501c6s, DMOs, the travel industry that's been really just hit so hard. Is there any status on where they are and what's going to be included in their package?
Yeah, we've been fighting for that on our side of the aisle. I don't know whether it'll be in the next package or not. I just don't know. There's some resistance to that, as you know.
Okay, that worries me. I mean, we're uniquely situated, with beautiful outdoor activities and a drive time, and we could be, when the time is right, at the forefront of some of this recovery, but that stuff is going to have to be included in the package.
Like I say, we believe in it. We're fighting for it.
So one of the constituents sent in something that I think has been overlooked, and it's very, very important. Everybody is so stressed, and there is an emotional toll being taken on people everywhere who have loved ones who are suffering in the hospital and they can't communicate with them. And this person was hoping for some sort of small fund or a way to get some video chats or communication with loved ones in the hospital, that it would be better for the patient and, you know, that kind of thing, really better for the patient, better for the family. I mean, everyone's focusing on business and economics, but the toll and the heartbreak can't really be overlooked.
Yeah, I mean, you're right. It is a unimaginable thing that is happening out there. And I've seen a lot of that. I mean, this technology, Zoom, obviously, is something none of us really probably used before the last month. I know that patients and caregivers have been using, you know, phones, right? Using FaceTime and using, you know, other services to do that, what you're talking about. In terms of a dedicated fund for it, I haven't seen any proposals on that, but you know, we're happy to take a look at anything somebody's suggesting. I do think the existing technology out there is pretty good in terms of connecting us. You know, it's no substitute if your mom or dad's in a long-term care facility, or you know, you got a sick kid. I mean, I can't imagine what those families are going through. But I have been impressed by, you know, I mean, some things are going to change forever, folks. I mean, I've talked to a lot of physicians and hospital physician networks that have said we begged people to use telemedicine. Nobody would adopt it. Now there's a huge surge in telemedicine. So we are all becoming much more accustomed to procuring certain kinds of services. But whether there ought to be a dedicated fund or not, I'd be happy to take a look at a proposal. I haven't seen anything for that.
Well, I think it's just important that we get the message to you of what folks are thinking, and even a system. I mean, I know that our healthcare professionals, my next door neighbor's a nurse, and I know that she's been helping families, and I think we have, you know, the most compassionate people at the front lines, but people are hurting.
Right. Well, I should say I have legislation that would compensate frontline workers for their service along the lines of hazard pay, or in an analogous way to how we treat people who are in combat, by essentially stop taxing their earnings from a certain point of the year forward when the pandemic began. And that would be a tangible way for all of us to say thank you to frontline workers. And there's a good system for doing that. So I've written legislation that we're trying to get passed that would do that. There's other proposals to have compensation funds for healthcare workers, frontline workers who've been personally hurt, affected, in addition to, say, a compensation bonus. And I know there are private funds being organized to try to do some of the same stuff. So, yeah,
Okay.
it's
Thank
important.
you.
Very important. Quick question, and then I'm going to ask George Joyner from SCORE if he has any questions. So George, you can unmute yourself. But Congressman, I'm not sure if we talked about 501c6s, but one of my questions, I guess, is if that will be a part of phase 4, or is they hesitant because unions are mostly 501c6 organizations?
You hit the nail on the head. So Lucy and I were just talking about this. So I support it. There is some resistance to that. I'm trying very hard not to be partisan in this call, particularly with anything associated with Putnam County. But let me just tell you that if the blue team were writing these rules, 501c6 would have been included the first round. We're putting it in now. Right, there is resistance on that because they're afraid of helping labor.
Thank you. So
that's as plain as I can tell you.
And they can't really split it. They can't. They can't do one and not the other.
Well, I mean, you know,
to
Amy's point, you know, if we are holding up the Paycheck Protection Program to try to get more aid to things like 501c6, to try to get state and local aid, to try to do things that we also believe is important, we are trying to balance how long this negotiation can take,
yep.
You know, and how much pain is going on out there while we're still fighting about it in Washington. So the first package was so big and so bipartisan, I think it gave some hope that we could move more rapidly through these things. But I mean, look at folks, you're talking about hundreds of billions of dollars. The numbers can make your head swim. There is going to be a bill coming due for all of us for all of this, which is something we also need to keep in the back of our minds. And not only that, but, you know, this is being done remotely under bizarre conditions where Congress is not allowed to, there are no committees meeting. There's none of the usual ability to do this. except through conference calls and remote technologies, and even getting us all back to vote is going to be some big production because of all the social distancing rules.
Yeah.
So there's a lot of additional, you know, kind of moving parts here.
Yes,
But I
sure.
do think if we can double the size of the PPP program this week, if we can keep a good bipartisan support for the basic stuff, hospitals, helping our you know, unemployed folks, helping our people who are really hanging by a thread, and hopefully including some of these things like 501c6s and others that there's just no reason to leave them out.
Agreed. Okay, thank you. George, you have a question?
I do. Just two comments. First, Congressman, thank you so much. I can't imagine what it's like carving an hour out of your day or more to meet with us. It's got to be crazy for you, but thank you very much.
Well, I get paid to do this, so.
Not enough.
You said it. Yeah.
Yeah, I believe it though. Just first, a little bit of feedback. Banks that seem, from my constituents, that have been very helpful are Key Bank and Mayapack National Bank in the PPP loans, and Chase is an unmentionable.
I've heard bad things about Chase too. I don't know why. I'd like to learn more. What can you just tell me? I mean, I would love to hear anecdotally. I mean, how many people have you heard say, you know, yeah, I applied for the loan, my bank got it to me, and you know, and I'm hanging on, I'm doing okay. You know, the money's in my account. Versus,
George,
I hear almost exclusively the opposite, which is that I haven't gotten anything. What the hell's going on? But what were you going to say?
Anecdotally, Chase refused to accept 2 applications because they were clients. They didn't have outstanding loans. They were very small, and Chase didn't accept their PPP loans. But the one where I have much more information on, decent-sized organization, about $1.5 million gross, 20 or so employees, a lot of 1099s and some full-times. Doing business, had an open loan with Chase, submitted their application within 3 days of, what was it, April 3rd, they got it right in. 0 feedback until yesterday. They learned that Chase has actually approved their application, and in the next round of funding, they think they're going to be able to send it in. Yeah, that's anecdotal, but that's very accurate. The first 2 were very sparse. So that's why I singled Chase out, whereas I've had several clients of mine through SCORE who went to Key Bank and Mayapack both without being clients there, and were welcomed, and their application was taken in and handled. So very different approaches to the business.
But as far as funding in general, I think I've only heard of maybe 20 businesses.
What funding?
20. Yeah, there's very few businesses have actually received. There's some that have been approved. They're waiting to hear. Some that haven't heard anything, and very few that have actually received anything yet. And we have a lot of people on Facebook Live just talking about their general stimulus checks, asking where they are. How come we haven't received that yet?
My corollary point, if I may, to the bank comments was, and I have no idea of feasibility or how you'd even do it, but some kind of a feedback system would take so much pressure off so many people. I submitted my EIDL or my PPP application, and it's gone. You know, that's the last communication I've had with anybody.
Yep.
Or the bank said, got it.
Well, right. So there's 2 ways to get at that, right? One is the bank's got to, you know, get their act together and get the money out the door. And I think I like the way you broke that down, because my experience has been, I hear good things about some banks, and I'm not trying to single anybody out, but it just seems like some banks have their act together more than others, for sure. Absolutely true in the Hudson Valley, both sides of the river. I hope most of that is getting ironed out now, and that those bottlenecks now will be cleared away, and the overall funding in the program won't hold it up either. And so a whole nother round of people should be getting help, you know, soon. That is the way that is what should be happening. But getting this feedback is really valuable for me because I want to see what shows up. I mean, my reaction when they said the program's almost out of money was, I don't know anybody locally who got any out of the Paycheck Protection Program. And so who the hell got all the money? Now, if you're talking about the stimulus checks, right, you can reliably predict that if you get direct deposit for your tax refund and you have adjusted gross income of less than $150,000 as a couple, that money's coming very shortly. If you don't use direct deposit, it's going to take several weeks more because they're going to be mailing out checks at the rate of like 5 million a week or something. So that could take people longer. It's not too late, by the way. People can go to the irs.gov website and there's a portal there for getting your payment. But those things I have more confidence in. That's just direct cash transfer. That's going to happen.
I think the public.
I'm worried about the different experience with the banks on the loans, though, and then the overall funding of the program. And what I will tell you, what keeps me awake at night is that we may not be able to cover this whole thing if it goes on too long. That no amount of government funding can replace a $20 trillion economy that has been shut off like a light switch if it doesn't restart at some point. And so what does worry me is that while we can cover people for a while, and these obstacles we're seeing, as far as I can tell, are mostly logistical and bureaucratic and then a funding issue which we can fix in the short term, and that should all work out. And so if we're having this conversation 3 weeks from now, I would hope that most of the folks who've been frustrated are getting some help. If we're having this conversation 3 months from now and we haven't been able to restart the economy because we haven't got a handle on the public health emergency, I don't know if we're going to be able to continue to fund these things indefinitely. So that's why it is so critical that we defeat the virus in the shortest possible time, because the scale of this thing is unprecedented in any of our lifetimes. But I do think some of the program problems that are showing up for your folks locally, I gotta believe we're gonna be able to work through some of those in the next few weeks. But I want to hear it. I want to hear it if we're not, because the first round came and went, and I didn't see a lot of local benefit.
So Amy, our legislator Amy put a statement up, really, and I actually just stopped watching live what's going on in Pennsylvania at the Capitol, and is
that the demonstration to reopen?
Yeah. So Amy says people want to go back to work, not handouts. How can we get back to work? And that's where it gets really confusing. And I will say we're a very Republican county, and our county government is encouraging people to shelter at home, go out as little as possible, don't get into large gatherings, you have to wear a mask. We're doing all of that. It's really difficult, though. There's parts of New York that are right next to Pennsylvania, or wherever, and I'm not trying to pick on Pennsylvania because they don't represent everybody in Pennsylvania, but if we don't really have a solid plan in this country to stay home and let this virus run its course, how are we ever going to get back to work? So Amy, I understand your question, but it's not, it's confusing.
Listen, we all feel the same way about this. I mean, come on, guys. The truth is we are balancing two very, very, very painful things, right? We've got to defeat the epidemic. We gotta go back to work, and we have to do both. It's a sequence. And the reason we have slowed the new infection rate in the Hudson Valley, in Putnam County, you're talking about a couple new cases a day at this point, 599 total. Now it's not a big county, but to have slowed the new infection rate to—
It's actually 807. There's a lag in the state website. It's 807, and we had 4 deaths this weekend. So everybody woke up this morning a little.
Well, then I learned something, but I think you would still see the new infection rate down to below 2%, yes. which is what you want to see. And you're going to have the deaths following on because those are the people who got sick 2 weeks ago. Right. So the human cost is still heartbreaking, but it's working. The strategy is working. Now, I got it. We're paying a heck of a price on the economic side, but we are, it seems to me, this close to getting down to a manageable situation on the public health emergency when we can have a reasonable conversation about how do we get back to work. But this notion that it's one or the other, I think is just we all know better than that. I mean,
and there's also the fact that, you know, and I've said this before, and I'm not popular for saying it, but a lot of businesses, you know, didn't shift in the last 2 years when they should have. And so right now, yes, you need to be waiting for money and hoping that you're going to get some help to get through this, but you also need to be figuring out, what is that new game plan? What business can I do? And what am I going to be doing the minute things start to reopen? And that's one thing this group is going to be working on countywide, inviting the supervisors and the mayors to come up with a plan for when things begin to reopen, so that we're not just sitting around waiting and then, okay, now what? Businesses have to pivot as of weeks ago. And if you're behind, we're here to help, and we want to bring you whatever information you need, whatever skills you need, whatever you need need to learn to be able to move your business forward. And I think a lot of businesses, you can already understand. Real estate is lucky. We kind of shifted a while ago, and now it'll go full circle. I mean, there are some places where real estate is only done online, on the international market especially. So that will be easy. Restaurants, a lot of them have already shifted. They have put their models to where they're complete takeout. We have local restaurants doing happy hours that they'll deliver. So I know it's difficult and I know it's scary, but at the same time, some of the responsibility has to be on us. We have to be able to move our businesses forward and come up with plans that will help. So my business counsel, I'm going to allow Faith Ann Butcher to speak in like 1 second from United Way, because she's obviously a very intricate part of what's going on in the county. But to the rest of my panel, do you have any other business related questions or not? Well, Faith is going to ask not-for-profit for the congressman. Just unmute yourselves. Okay. All right. Faith.
Good afternoon, Congressman. I'm curious, the need has gone up tremendously all around, especially with food insecurity. And I'm fortunate enough that we have grants that can actually buy food to be able to get, to be able to try to help some of the residents. The problem that we have is that we can't get a supply. So the last distribution we actually had 5,000 pounds that was produce and healthy snacks. We couldn't get any meats, we couldn't get any pastas, any rice, and this is what we were passing on to seniors and those who are immune compromised. And I called out to major supermarket chains, major vendors, and it's just not available. And how can we help with the flow? Because these are some of our most vulnerable population, and the food's not available.
Yeah, it's such a great question, Faith. So I was on about an hour-long conference call with the chairman of the Agriculture Committee this morning on this very issue. What is so crazy right now is that they are slaughtering 10,000 hogs a day in one state because of the closure of those processing plants, because they just can't do anything with them. And yet, on the other end of the spectrum, we're going to have people who are food insecure. We're going to have shortages. And the problem is because you have surpluses at one end of this processing and distribution chain, and you're going to have shortages at the other, because the food that is processed and prepared for restaurants is not the same as the food that goes to grocery stores, and the stuff that goes to food banks is not the same stuff that is now lost its market. So we're working through some of these issues. But I can tell you it's disturbing. I'm tempted to say, like, please, maybe my staff can work directly with you and we can find some better sources for you, because trying to fix these systemic issues is brutal right now. I think we have better success just trying to help people locally with whatever problems they have. So if you're willing, we can maybe go to work with you. But,
I would absolutely love that. That would be great.
It drives me crazy, because on the one hand, I listen to dairy farmers say they're dumping the milk in the fields, and on the other end of the spectrum, we're having people who are waiting in line hours at food banks, and the normal distribution system is all screwy. But it is heartbreaking to know that we are wasting huge amounts of food right now. I mean, the number of live animals that are going to be euthanized and in very disorganized and brutal fashion right now in the Midwest because of the outbreak at these processing plants is going to, I think, shock people, when at the same time we realize there's going to be meat shortages at the supermarket. And so we are not where we need to be at the national level on that. But let us help you on the local level, because I think we'll have more luck.
Thank you.
That'd be great. Okay, well, I'm going to wrap this up. Congressman Maloney, always a pleasure.
Thank you
love
all.
having you here in the county. I don't get to see you enough, but I get your Christmas card, and I do like that. And
Okay. Well, that's nice. Well, listen, hang in there. I mean, you all are all leaders, and I appreciate you engaging with me. Please stay in touch with my staff. We're here. We want to hear all the news, whether it's good or bad or not. And it really does help me when I go back to Washington to say, here's what's showing up for folks.
yeah, we'll send you the questions also direct as they come, and we'd hope you come back in a few weeks. I'll work with Paige and Ernest on that.
Happy to do it. All right, guys.
Thank you all.
Thank you,
guys.
Congressman.
Stay safe, everyone.
Safe.
Stay safe. Thank you, guys.